I am Professor Anand Shetty. I'm a professor of orthopedics and director of the stem cell research at Canterbury Christchurch University. I work at Spire Alexandra Hospital as a knee surgeon. At Spire Alexandra Hospital, we have a specialized team which looks into the cartilage imaging, surgical techniques, and the post-op rehabilitation. We also treat some of the complex fractures which either fail to unite or have been advised amputation. We managed to save quite a few limbs recently with this new technology and treatment.
I'm Mr. Saif Ahmed. I'm an orthopaedic surgeon working in the Kent Orthopaedic Group. My special interests are hip surgery, limb reconstruction, and precision orthopaedic surgery.
My name is Sajid Sharif, and I'm a consultant orthopaedic surgeon, and my speciality interest is in surgery of the foot and ankle.
Hi, my name is Keith Borowski. I'm an upper limb orthopaedic surgeon. I deal with everything from the shoulder down to the elbow, wrist and hand. I've been a consultant for about 30 years now, and my specialism is really shoulder and elbow particularly.
The advantages of a multidisciplinary group is that we can discuss, especially patients who have complex needs and complex injuries, so that we can make sure that we will provide the very best outcome for our patients. We also have put together specific protocols for post-operative rehabilitation, which our physiotherapists are also able to provide.
If I had a fracture or a dislocation or an injury, I would ask a consultant to get a diagnosis immediately, because the earlier you get that, the better it is for treatment.
We use stem cell therapy either from the patient's own cartilage or the stem cells cultured in the lab, or sometimes we use the concentrated cells with a special gel.
My name's Ian Willis. I am 48 years old, active sportsman for many years, but unfortunately found a problem with my knee. Professor Shetty recommended to me was the replacement of my damaged cartilage, utilising new technology which would entail growing a new cartilage from stem cells, my own stem cells, taken from another part of my body. Things are now going well. I am 6 weeks from the stage 2 surgery, which was the reintroduction of the stem cells into my knee. The plan will be to, after 6 months, undertake a further MRI scan just to see what progress is occurring and whether the hyaline cartilage is actually growing. But so far, things are looking promising.
At the Kent Orthopaedics Group, we use special imaging techniques to obtain models of a patient's limb. We can use patient-specific customized jigs, some which we get from abroad and some which we manufacture ourselves in order to produce the most precise and accurate cut that is achievable for our implant surgery.
I'm Brian Sellers. For some years at work, I did a lot of manual work, shop fitting, ladder work, which took its toll on my knee. And I've had several operations on it with torn cartilage, cysts, and it came to a time, because of pain, I had to have a new knee. And I come to see Professor Shetty, and he put me completely at ease, told me what was wrong. He said, we can do something about it. Explained the procedure and booked my time in, and it went very well. The pain had gone.
We have a great team here at the Kent Orthopaedic Group. We have an excellent radiology department to make an accurate diagnosis.
Hello, I'm Praveen Bilaji. I'm one of the consultant radiologists at Spire Alexandra Hospital. My main interest is musculoskeletal radiology. As a patient will see your consultant in clinic, they will have a suspicion of what might be the cause of your symptoms, and then they will usually request imaging, which may include plain films, MRI, and or CT scans. And my job then is to work out what's actually causing your symptoms. And the clinician then uses my reports along with the images that you see here and ties them all together to work out what's actually causing your symptoms in the first place. And then surgery may or may not be performed depending on your imaging.
As a leader of the team, we have set up one of the unique service where all the specialties work together, including the staff, physiotherapy and management and the supporting staff.
To date, I've been extremely pleased with the professional services provided by Professor Shetty and his team, and could not fault them in any way.
We have a caring professional staff, an up-to-date theatre with excellent staff and up-to-date equipment. And of course we have an excellent physiotherapy team that can take you through the rehabilitation that you need. As I say, it's not necessarily surgery, but if you do need the surgery, of course that's what we would do.
I was well pleased. It went well. The nursing staff were fantastic. I felt safe.